Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Our goal is to make a positive impact in the dental field. I have been a dental assistant, a biller, an office manager, a scheduler, a hygienist, and a dental coach, which makes me your biggest fan. My husband was in the military and we traveled all over the United States. I had opportunities to work in many different practices, and I saw incredible practices and practices that had a lot of potential within them. Thank you for joining us. Let's dive into the podcast.
Hi, Alicia Flynn from Increda-dental. Now, I want to let you know that this is a problem we're going to talk about today where every office is affected with this, and you're not alone. And that is that most dental offices have about $1 million worth of treatment that's been diagnosed that has not been completed in the charts. And we're going to speak about how to help your practice by having your team understand the role that they can play that can have a positive, powerful impact on the health of your patients and also on your practice. Increasing the health of our patients and having our practice be healthier has huge amounts of potential. Nothing moves the practice forward in momentum than when a patient accepts treatment and then completes it. It helps energize the practice. It brings value to each member of the team and validates to them why they're doing what they're doing. It helps them to feel that they are adding to society, keeping people healthy. Now, what I'm going to speak about is co-diagnosing, but I want you to keep an open mind about this because a lot of people feel threatened when I speak about this. This is a challenge. People come in and they spend 40 minutes with the hygienist or 20 minutes with the assistant, and they speak about vacation and how their family is and what's going on in their personal life, but they never mention to them that they're concerned about something going on in their mouth. And this is an obstacle then when the dentist and the provider enters the room and says, oh, hey, I'm worried about this tooth after 5 minutes. They're questioning, the patient's questioning, why hasn't anyone mentioned this to me? Why is it that this is only being brought to my attention right now? So we need to change that about training the staff and having them speak about things they're worried about. Now, I understand you're saying, well, they're not allowed to diagnose, they're not trained. I'm not saying that they're diagnosing. Is what I use is very gentle wording. Is I let them know, I'm not able to diagnose, but looking at your x-ray, I am worried about a couple teeth in your mouth. Or when I'm cleaning their teeth, I'll notice that there's a very large filling and I think there's a crack going down it. I'll tell them this tooth here and I'll touch it with my fingers and I'll let them know it has a very large filling in it. I think there's a crack going down it. I'm worried about this tooth. Let's see what the dentist has to say. But I'm preparing them to let them know there's a concern. And by doing that, they're already starting to buy in to the treatment that they need. They're beginning to understand that not only the dentist is seeing this, but also other providers, healthcare professionals in that practice are also seeing them. Now, what we need to do at this point is to understand how people learn. About 65% of the population, they are visual learners. They learn by seeing. 25% learned auditory from words, 7% are readers, and 3% are doers. Is what we need to understand is by saying it twice, once from one hygienist or assistant, and then from the provider, the dentist, we're hitting that, and then that 25%. But if we grab that intraoral camera, if we take a picture and we show it to the patient on the screen and say, do you see this tooth? Do you see the large filling in it? And this looks like a crack going down it. This is what I'm worried about. When we show them that, we're hitting about 90% of the population and the way they learn because we're showing them and then we're also repeating again so they can hear it and they're learning those who are auditory learners. So that's an incredible impact of having the patient hear it twice but also see it. It helps the patient understand the concern. So an example is a patient that I had in the chair. I was taking a picture of his tooth that was cracked and the large filling that was in it, but he noticed all the stain. And he was like, oh my goodness, what's going on? Am I okay? Is that cancer? He was really worried about it. And I said, no, you have staining. And we talked about how he chews. and the impact it was having. And we dived also into the tissue, and we took pictures of the tissue. The next time the man came back, he had stopped chewing because he was really motivated because his concern for his health started to show up. Granted, he'd also his wife had just had a baby, but that might have been part of it too. But educating them with an intraoral camera brought it to his attention in ways that speaking never would have worked for him. So using the intraoral camera is very powerful in your practice. And you can have a little contest with your hygienists and assistants and see who can take the most intraoral camera pictures in a week. And so that way you're encouraging them to move forward by teaching your patients about the care they stand in need of. But you want to pull out that intraoral camera and have them educate the patient so that way they're already prepared for when the provider enters the room. I want to point out too that sometimes I miss things. Like the dentist comes into the room and he's like, I'm concerned about this tooth. Did they say anything about it? And I'll be like, oh, I missed it. But there's other times when I have been overzealous, when I have looked at a tooth and been like, ooh, this is a big filling. Let's see what the provider has to say, what the dentist has to say about this tooth. And the dentist will come in and he comes off as a hero. He's saying, no, this tooth is fine. There is a large filling there, but it's holding together. Let's keep an eye on it. I know that someday down the road, we're probably going to need to get a better coverage on this tooth. But that shows the patient that he's their advocate too. So it's really nice. It serves many purposes. Even when I'm wrong, it helps them see the dentist as a provider. So what you need to do is you need to train your staff. So gather some x-rays, some intraoral pictures, and ask them, what would you do in this circumstance? What would you tell the patient they might need, or do they need something? And educate your staff on what certain things you want to offer your patients and how you can provide them with better treatment. Now, if you need help with training, we do offer training with co-diagnosis to help lift that burden, because the last thing often a provider needs is another thing to do. But taking the time to teach your staff and help them recognize the treatment that's needed will help your practice get that treatment that's planned, that lays dormant in your charts, and get the chairs filled and get your patients in better health. Thanks for joining me.